All
સર
participants.
ડબલ સાઉન્ડ એટલા માટે આવે છે કારણ કે મારામાં યુટ્યુબ બી ચાલુ છે સાયમલ્ટેનિયસલી એટલા માટે. સર તમે રેકોર્ડિંગ સ્ટાર્ટ કરી દેજો તમારા પીસી ઉપરથી સર.
આમાં રેકોર્ડિંગ સ્ટાર્ટ જ બતાવે છે.
હા એટલે હું હમણાં લીવ કરીશ ને એટલે કદાચ રેકોર્ડિંગ જતું રહેશે તો એ ટાઈમે તમે સ્ટાર્ટ કરી દેજો સર.
ઓકે ઓકે કઈ વાંધો નહીં.
All participants are requested to keep your video on. To keep your video on for the photo session. And mute your mic. વિડીયો ઓન રાખશો તો સ્ક્રીનશોટમાં પણ ઈઝી રહેશે અને તમને લોકોને કોમ્યુનિકેશનમાં પણ મજા આવશે. સ્ટુડન્ટ્સ તમારો ફેવરિટ ટોપિક છે વેબિનાર માટે. જીનલ મેડમ.
हाँ टीना मैडम गुड इवनिंग.
हाँ फार्मडी ने में
ગુડ ઇવનિંગ.
हाँ रिमाइंडर.
गुड इवनिंग.
हाँ
हाँ फैमिली में मैं मूक्यू रिमाइंडर.
ओके. हाँ
फरीथी लिंक में मूकी दीजिए.
हाँ हाँ
मारो वॉइस आवे छे क्लियर?
हाँ क्लियर आवे छे. સ્ટુડન્ટ્સ ફરીથી બધા વિડીયો ઓન કરી દો તો મને સ્ક્રીનશોટ લેવામાં આસાની રહે. થોડાક જ સ્ટુડન્ટ વિડીયો ઓન રાખી રહ્યા છે તો ઓલ આર રિક્વેસ્ટેડ ટુ કીપ યોર વિડીયો ઓન. Dhaval sir, can we start?
Yes, ma'am, we can start.
Okay. So heartily welcome Nishant sir on
Thank
behalf
you,
of
madam.
IPS. Good evening, all of you. Hope you all are excited to attend this webinar. That title of your interest, that future scope and career perspective in Canada. You all are loving for going to the abroad and Canada. So I think you are awaiting for this webinar. So not taking so much time, I just invite to Dr. Jinal, Assistant Professor in Pharmacology, to introduce Mr. Nishant Patel, sir, who is a registered Canadian pharmacist in Canada and also CEO of Future Foreign Overseas. So please, Jinal madam, over to you.
Good evening, Nishan sir, Dhawal sir, and Jigna madam.
Good evening, madam.
Good evening, all the students. Thank you, Nishan sir, for joining this webinar and give an opportunity to SIPS. Sir passed out the Bachelor of Pharmacy in Nirma University, Ahmedabad. Sir completed the Biotechnology Industrial Microbiologist program in Ontario, San Antonio College. Sir is a certified injection administrator in 2014, and Sir is a certified diabetic educated course in 2017. Sir also crossed the PBC exam, and Sir get a registered pharmacist of Canada in 2011 to 2013. Sir has more work experience in pharmacy technician area in AEC Pharmacy in Brampton on May 2011 to June 2011. Sir is working as a pharmacy assistant in Loblaw Pharmacy, Alliston in Ontario since December 2011 to April 2012. Sir has experience as a pharmacy assistant in Loblaw Pharmacy and Moosjaw, Saskatchewan in June 2012 to June 2013. Sir worked as a pharmacy intern in British Columbia since December 2013 to between March 2014. Sir worked as a pharmacist in Loblaw Pharmacy in British Columbia in March 2014 to October 2016. And now Sir is a pharmacy manager and owner of the Hillside Family Pharmacy in British Columbia since November 2016 to continue up to this time. Thank you so much, Nishan sir.
Thank you, madam.
Yes, I over to you, sir.
All right.
Start the content now.
Okay, sounds good, ma'am. Thank you. Thank you so much, Jinal ma'am, for giving very detailed introduction about me. So I don't think so I need to give it again. And even if I'll give it again, I don't think so I'll be able to cover as much as what Jinal ma'am has covered for me. So thank you so much for that. My name is Nishant Patel. Hello, friends and students. I hope you and your family is doing well in this COVID-19 pandemic situation. And let's pray we come out from this situation pretty soon. So I feel like I'm just graduated yesterday from Nirma. My memories are so fresh from Nirma. So enjoy each and every moment while you are there. And keep smiling. We don't have any reverse button in our life. So right now, some of you guys may be thinking that when will I get out from my pharmacy college, or when will I be done with my pharmacy? But your real world will actually start after you'll be done with your pharmacy. But students who are in third year, fourth year, or students who are in pharmacy, this is the right time for you guys to think about the future, like what you guys need to do. So after you are done with whatever course of Bachelor of Pharmacy, then you don't have to worry about it, and you can just pursue your career further. So for an example, when I was in my third year, my goal was pretty much clear that I wanted to go to Canada and I wanted to be a registered pharmacist in Canada. So in third year, I actually gave Ielts, GRE, as well as TOEFL as well. So you guys may be thinking that why GRE and TOEFL together with Ielts? So I kept US as my second option. So if I wouldn't be able to get visa for Canada, in that case, I was going to apply for US. So I got admission from very reputed colleges and very reputed university from US as well. So I got my admission from Massachusetts College of Pharmacy, as well as I got my admission from Northeastern University as well. But as I said, that I kept it as a second option for me. So I would like to share with you guys a PowerPoint presentation here. All right, so why Canada and why not any other country? So Canada is the second largest country in the world. Yes, second largest country in the world with only 38 million population, compared to US has 328 million people. Another thing is Canada is still growing country and there is a lot of room to grow. So that's why they are allowing a lot of educated people to come to Canada. So they actually want to get a young talent like you guys. And it's easier for you guys to get permanent residency compared to if anybody who is like, let's say after 50 or 55, they are trying to apply for permanent residency. It's easier for young people to get permanent residency in Canada. As they are still growing and they want various area to grow in Canada in the business field as well. Another thing is it's easy to get permanent residency and citizenship in Canada. It's very easy to get permanent residency here. Another thing is after you become a citizen in Canada, you can go to 140 countries without any visa. That's right. So you don't need to go to, you don't need to take any visa or anything. Let's say if you need to go to Australia, Europe, US or Mexico, if you need to go to any country at all, you don't need to take visa. You just need to board on the flight and then you're good to go. So that's another most important benefit. So why Canada and why not US? I would like to give you guys some of the examples and some of the points why Canada and why not US. So when I passed out in 2010, I had so many of my friends actually, they went to US, and some of my friends, they came to Canada, they came to Canada as well. So let's say so many of my friends, even right now, even after 11 years, they are still struggling to maintain their status in US. They are still struggling to maintain their H1 status. It's very, very difficult to maintain your status in US after you are done with your study. And so many of my friends, they are actually kicked out from US because they couldn't maintain their status. So one of my friend, he did his biotechnology from Northeastern University, and he worked there for 1 year, and after that he couldn't maintain his status. So then after that he applied for a permanent residency of the Canada, and he ma'am, can we request everybody to mute their mic, please?
All students are requested to mute their mic.
Thank you, ma'am. Like for an example, as I said that my friend, he did his biotechnology from Northeastern University. He worked there for 1 year and he couldn't maintain his status. So then after that, he put file for permanent residency after almost 4 years. So after 4 years, when he comes to Canada, that means he is starting everything again. And some of my friends, they are actually moved back to India. So one of my close friend, he's working in a pharmaceutical company in India from last 4 years because he couldn't maintain his status in US, and now he's trying to come to the Canada. So it's very, very difficult to maintain status in US, while if you were to come to Canada, it's easy to get permanent residency and citizenships. And another thing is, let's say if you are a Canadian citizen, then there is an agreement in between US and Canada. So if you're a Canadian citizen, if you want to work in US, you are freely or you are free to work in US. Nobody is going to kick you out from from US. So that's another benefit of staying in Canada. So another thing is Canada is sharing, so many of the Canadian cities are sharing border with so many US cities. So for an example, Vancouver is sharing border with Seattle. So many people, they are living in Vancouver and they are doing commuting every day to Seattle. And so many people living in Seattle, they are working in Vancouver. As well as lots of cities from Ontario as well. They are sharing the border with US. Many cities from Saskatchewan as well sharing border with US. So if you're living in any border city, if you wanted to work in US, you can work in US. That's no problem at all. As I said, that they both have a agreement in between both of them. So that's another benefit of staying in Canada. So how to get a permanent residency in Canada? So there are two different options basically. One is provincial nominee program and second one is federal skilled worker. So under provincial nominee program, there are different kind of program going on. So let's say, for an example, if you're a pharmacist or if you're working in a pharmaceutical company or if you own a business, then you fall in particular class and you can apply. So in provincial nominee program, you apply at a level of province. So you get permanent residency of the province. And after you get a permanent residence of the province, you need to apply at the federal level. Compared to the difference in between federal skilled worker is if you wanted to get a permanent residence at federal level, so you directly applied at a federal level. So province doesn't come in the picture. So if you wanted to apply in a category of the federal skilled worker, you put your file directly in the federal, you bypass PNP, provincial nominee program, and then you right now with the federal skilled worker, let's say if you're a pharmacist, then you can get your permanent residency probably in 6 to 7 months in fast track. So it's pretty quick. And there are some other programs going on as well. So let's say, as I said, that if you are a pharmacist, then or working in a pharmaceutical company, then it's very, very easy for you guys to get a permanent residency. And if you're in Canada, if you're a permanent resident and if you're staying in Canada for another 3 years, then you are eligible to apply for a Canadian citizenship. Another thing is recently, due to the COVID-19 pandemic, there was a shortage of healthcare workers. So government actually approved 90,000 application of students who were on a work permit visa. So they actually approved their 90,000 students application and they made them directly eligible for the permanent residency. Just recently, last year it happened. Another benefit of staying in Canada is, as I said, that there is only 38 million population here in Canada. There is not much competition here in Canada. So if you open up any business or if you do anything at all, you will succeed for sure. There isn't much competition. Another thing is you get a free healthcare as well. So let's say if you have a fever or if you have any pneumonia, any infection at all, and if you were to go to a doctor, then everything is covered through the government of Canada. It's a universally government funded healthcare program. You don't pay anything at all for surgery or anything. For an example, let's say let's say it's an unfortunate event, but let's say if anybody's parents or grandparents has to go through any operation, any heart surgery or any liver operation, any operation at all, everything is covered through the government. So that's the biggest benefit of staying in Canada. Apart from that, medications are not covered. So anybody who is working, they have their medication insurance through their employer. So most of the time employers pay for the medication, and sometimes it's a 50-50. So 50% insurance paid by the employer and 50% paid by employee. That means workers. So by that way as well, people's medications are usually covered through their employer's insurance too. So most of the people have those things covered as well for them. So that's another benefit as well of staying in Canada. So now let's go to the next slide. So why pharmacy in Canada? So as per recent survey, Canadian pharmacists, as per the Canadian Pharmacists Association, there is a nationwide shortage of pharmacists in Canada. Yes, there is a shortage. The thing is, there are so many pharmacists who are older and they are retired, and so many pharmacists are about to retire. So it's very, very tough to find a registered pharmacist at the moment in Canada. As there is a shortage. Another thing is you guys will make a good money if you are a registered pharmacist in Canada. It's one of the top-notch profession in Canada. So let's say if you are working 5 days per week, and if you are working 8 hours every day, then so for an example, if you are working Monday to Friday, 9 a.m. to 5 p.m., 8 hours every day, then you can easily make $130,000, which is almost 70 lakh Indian rupees. And some of my friends, they are not married yet, or they are still single, and they are actually working 7 days per week. So if you were to work 7 days per week and 8 hours every day, then you can easily make $200,000, which is 1 crore Indian rupees per year, which is a very, very good pay actually. Another thing is your hours are flexible. So you can pick whichever shift you want. You can work morning shift. Let's say if you wanted to work 9 to 5, you can work that shift. If you wanted to work afternoon shift, 2 to 10. If you wanted to work night shift, let's say if you wanted to work 10 at night to 5 in the morning, you can work that shift as well. So it's up to you, whichever shift you want to pick, you can work. Another thing is it's very respected profession. So over here in Canada, actually patients are trusting their pharmacist more rather than doctors. So if they have any question related to medication or anything, they don't go to doctors. They directly come to the pharmacist, or even if they needed to get any recommendation, they come to the pharmacist rather than doctors. And pharmacists are very easy to access as well. You can, after you become a pharmacist, you can work in a variety of you have a variety of different options. So let's say if you can work in a medical store, or you can work in a community pharmacy as a pharmacist. Another thing is, let's say if you guys are doing PharmD course, then you can work in a hospital as well, as a hospital pharmacist together with doctors. So if you were working as a hospital pharmacist in a hospital, then your role will be very crucial. So for an example, a pharmacist will be responsible at each or pharmacist is involved in each and every step in a hospital. So as for an example, let's say if a client has a compromised kidney function and creating clearance is less than 30 ml per minute, and client has a heart condition, let's say left ventricular dysfunction. So in that case, doctor will be relying on pharmacist judgment related to what medication should doctor start and what should be the initial dose based on the compromised kidney function. So if you're working in a hospital as a hospital pharmacist, if you're in PharmD, then your role will be very crucial. Another thing is you can work in the long-term care as well as a pharmacist. You can work in assisted living as well, or you can work in a government as well as you can work in a pharmaceutical company as well. So there are a wide variety of options available for you guys. Now, how to become a pharmacist in Canada? What are the steps to become a registered pharmacist in Canada? So first and foremost step is enrolling in a pharmacist gateway Canada. That's the very first step. So after you enroll in a pharmacist gateway, you will get a unique ID number. You will get a national ID number. So after you get a national ID number, you will have to go to the second step. So all of these pharmacy exams in Canada, they are conducting through Pharmacy Examining Board of Canada. It's called PEBC. So after you are done with registration, you get your national ID number, you need to do your document evaluation. So in document evaluation, you need to send your degree certificate, you need to send your transcript, as well as you need to send your course curriculum to the PEBC. And then after that, they will evaluate all of those things, and then they will let you know whether you are good to go or not. But most of our Gujarat students, everybody gets qualified to give exam. There isn't an issue at all. As long as you have got your degree certificate and transcript, you are good to go. So after that, second step, after document evaluation, is a evaluating examination. So evaluating examination, there are altogether 200 questions, and it's a multiple choice questions. And the beauty of this exam is all of those options of that questions, all of the options are most of the time, probably I would say not 90%, I would say 80% time, all of the answers are right. Yes, it's just you need to choose best answers from out of all of those 5 answers. And it's not tough at all. If you guys have read it thoroughly, it's not tough at all. So it's a multiple choice exam. And evaluating exam is only and only for international graduate students. It's not for Canadian pharmacists. So if anybody is, let's say, passing from India or Pakistan or Sri Lanka, Egypt, so anybody who is other than from Canada, who is or who hasn't finished their pharmacy from Canada, all of them have to give that exam. And evaluating exam is a little bit broad. It's a broad syllabus. So they basically cover in that a little bit of anatomy and pathophysiology, little bit of pharmacology, a little bit of statistics, a little bit of medicinal chemistry, a little bit of biopharmaceutics, calculation, and pharmaceutical management. So all of those things are covered actually in evaluating exam. After evaluating exam, second exam is a qualifying examination part 1. That is a multiple choice exam as well. So in qualifying examination part 1, it's mainly focused on a clinical related stuff. So in there will be a scenarios, big scenarios, and you need to go through that scenario and answer the question. So let's say they may say that patient has a asthma, patient has a blood pressure, patient has a gout and diabetes. Which medication will you give in this cases? You need to see that if there are any contraindication to any particular condition and stuff, and based on that, you need to give right answer. As I said, they are mainly focused on clinical, as well as they are mainly focused on calculation and pharmaceutical management related stuff. And I haven't seen, to be honest, anybody who cannot pass PBC exam. So PBC has actually altogether 3 exams: evaluating exam, qualifying examination part 1, which is MCQ as well, and qualifying examination part 2, which is a practical exam. So in each exam, you will get 4 attempts. So 4 attempts for evaluating exam, 4 attempts for qualifying examination part 1, 4 attempts for qualifying examination part 2, and it's actually more than enough attempt to crack this exam. And as I said, that I haven't seen anybody who hasn't passed the exam even after those 4 attempts. So it's not tough at all, especially for our students who are from Gujarat. Our course curriculum is very good actually, and faculty is very, very intelligent and dedicated as well. So after qualifying examination, I wanted to go through some of the questions of qualifying examination part 1, which I have got it from a PBC website itself. So let's go through some of these questions here. So when you guys give your exam, you guys wanted to make sure that your fundus for pharmacology is very clear, related to cholinergic system, adrenergic system, I mean sympathetic, parasympathetic nervous system and stuff. It should be very, very thorough. So atropine poisoning can be recognized by all of the following signs or symptoms except. So if you guys know that atropine has basically anticholinergic effect, and it has a tendency to decrease all of the secretions in the body. So it has a tendency to cause dry skin, yes. Flushed appearance, yes. Delirium and restlessness, yes. Mydriasis, yes. But it does not have tendency to cause diarrhea. It has a tendency to cause constipation. So incorrect answer in this one is option F. That's not a right answer. So achieving a high level of herd immunity is an important public health strategy because so you guys need to know what is a herd immunity. So in this COVID-19 pandemic situation, everybody's getting their vaccine. So let's say if 99% people are getting their vaccination done, and if 1% population cannot get vaccine due to, let's say, if they are allergic to vaccine or if they are contraindicated to vaccine, that 1% population who hasn't got their vaccine, it will be protected by 99% people who has got vaccine. So those 99% people who has got their vaccine, there are less chance for them to get the COVID, and it will actually protect that 1% population. So that's what it's called herd immunity. So if we will go through these different options, so it will basically protect the people who cannot be immunized. So it will be our right answer in this case. So one more question here. So what's the reason for using coating on the tablets include all of the following except? Why do we do coating on the tablet? Which answer is incorrect? You guys have to figure it out. So to mask the taste of the drug, yes. To mask the odor of the drug, yes. To improve the appearance of the tablet, yes. To protect the drug from stomach acid, that's right. We do enteric coating to protect drug from stomach acid. To increase the drugs release rate. So we do coating to delay the drugs release rate, to make it modified release, controlled release, extended release. So drug itself, it's an immediate release, and we do coding to make it modified release. So our answer D is not a right answer. So this kind of questions, these are the sample questions. I have got it directly from the PEBC website for you guys. So let's get back to our third part of the exam. So third part is a practical training exam. So in practical training exam, there will be there will be altogether 12 practical stations you need to go through. So there will be altogether 12 different rooms. You need to go in each room one by one. And there will be different problems you need to solve. So for an example, in one room, there will be a doctor sitting inside the room, and doctor will be asking for a recommendation. In second room, let's say there will be a patient sitting inside a room, and patient will have, let's say, side effect or something, and asking that what should patient do if that particular patient is experiencing, let's say, for an example, patient is taking antipsychotic medication, and patient is experiencing abnormal muscle movement, and patient will be asking that what should I do in this case. Then another station which may or may not be, it's just an example that this kind of stations can be asked. So pregnant lady is sitting inside a room and asking that what should she take for the pain medication. So this kind of scenarios they usually ask in practical exam. Another in this exam, you don't need to memorize anything for the third exam. As I said, you will have literature in front of you. In each station, you will get 7 minutes. So in each practical, so you will get 7 minutes. You need to go through literature and you need to give a correct answer. So I would like to give you guys one of this example to you. So for an example, there will be a door note. So before you go inside, there will be a door note you need to read. So let's say it says that doctor is waiting inside a room for a pharmacist for the recommendation. So when you go inside, doctor is sitting inside a room, and doctor is asking for your recommendation that, hey, pharmacist, I would like to give propranolol for migraine prophylaxis for my patient, and my patient has asthma as well. So if you guys have a pharmacology funda very clear, and if you guys go through the literature in front of you, then you guys will know that propranolol has basically beta blocker. It is a beta blocker, while in asthma we usually give medication which is a beta agonist. So if we give a beta blocker to the patient who has asthma, so it will resolve the issue of the migraine. It will help with the migraine prophylaxis, but it can make patients' asthma worse. So in that case, you need to let doctor know that this is not a right choice for our patient, since our patient has asthma, and in that case, you want to recommend something else, let's say valproic acid or topiramate or divalproex, based on patient's need. You need to give recommendation. Another thing I would like to mention about a difference in between Canada and India is, let's say in India, if your parents or grandparents give you an empty strip of medication for, let's say, blood pressure or acid reflux or stomach acidity, and tell you that can you go to pharmacy and get this medication for me, then if you will present that empty strip to a pharmacist in India, they will be able to give you medication without asking anything. But if you were to come to Canada, and if anybody is taking any medication, let's say for 5 years or 10 years, any blood pressure medication, if they needed a refill, they still have to get a prescription from doctor. Even if they are taking it for 10 years. So if anybody needed to get their medication, there has to be a prescription. Without prescription, I cannot dispense medication to a patient. Another thing is all of the pharmacy profession or all of the healthcare people, they have their profession they have got limited scope of the practice. So for an example, if dentist is writing down prescription for cholesterol or blood pressure medication in Canada, and if I get a prescription from dentist for all of this stuff, I cannot accept the prescription from the dentist, because dentist can only write down prescription for pain medication and antibiotics. In that case, I have to refuse prescription from dentist, and I have to tell patient that get a prescription from your regular physician. I can't accept prescription from a dentist. So this kind of things you need to probably, after you come to Canada, once you start preparing for exam, you guys will know all of this stuff, actually, because I didn't know either before I came to Canada. But you guys will know all of this stuff if you guys are planning to come to Canada. Some of the examples I would like to give you for my day-to-day routine. What do I do? So for an example, let's say client is bringing me a prescription for amoxicillin for sinus infection. And when I go through a patient chart, I notice that patient has a penicillin allergy. So in that case, I have to contact to a doctor and let doctor know, hey, doctor, our patient is allergic to penicillin, and what should we do? So in that case, doctor will switch to a different antibiotic, because if I give penicillin or amoxicillin to the patient, and if patient experience any anaphylactic reaction, then patient can die as well. So those are the responsibilities of the pharmacist. So let's say, for an example, in this scenario, patient does not have a penicillin allergy. So in this case, we'll just fill medication in a bottle or in the vial and put a label and give it to the patient. So when we give it to the patient, pharmacist has to go for a counseling. It is actually mandatory. We can't just let a patient go. Pharmacist has to intervene. So for an example, let's say when I go for a counseling, then I have to tell patient that this is amoxicillin and doctor wants you to take 1 capsule 3 times a day for 10 days for sinus infection. But most important thing, I have to let patient know that make sure you finish it for 10 days. Because even after they start, as you know that with any antibiotic, people start feeling better for infection in 2 to 3 days. So I have to let them know that even if you feel better in 2 to 3 days, make sure you finish it for 10 days. Because if they don't finish it for 10 days, and if they just stop it in 2 to 3 days, then chances that they can develop resistance to that particular antibiotic. And you guys may be aware that we don't have lots of antibiotics available in the market. There are very limited number of antibiotics available in the market. So if they develop resistance to that antibiotic, then next time they need to take antibiotic for that particular infection. In that case, they can't take it because it won't work for them. It's resistance now. So this one was one of the examples. I would like to give one more example as well. So for an example, let's say depression is a prevalent condition in Canada. So for an example, let's say patient has a depression and taking medication called citalopram for depression, and doctors prescribe ciprofloxacin for urinary tract infection. So after you become a pharmacist, pharmacist software is very smart. Pharmacist software actually tells us about all the drug interaction. It pops up drug interaction in a red flag if it's a severe or contraindicated. So patient, as I said, the patient has brought in a prescription of ciprofloxacin. So my system will pop up with a drug interaction regarding QT prolongation. So in that case, I need to contact to a doctor and let doctor know that, hey, doctor, we will have to order an electrocardiogram for our patient since it's causing a QT prolongation. So if there is an underlying heart condition for the patient, then in that case, doctor will switch to a different medication. So what happens if I fail to check for this drug interaction? So if I fail to check for this drug interaction, if patient suffers from any injury due to my negligence, in that case, patient can actually sue pharmacist. Yes. So, and another thing is all of the pharmacists in Canada, they have to take a liability insurance for $1 million. So up to $1 million, patient can actually sue a pharmacist for the negligence. So pharmacist role and responsibility is very, very crucial. It's not very stressful job. It's very easygoing job, but you have to keep your eyes and brain eyes open, and you have to keep your brain like very focused when you are working as a pharmacist. So what are that's how you can become a registered pharmacist. And so those are the steps to become a registered pharmacist and duties of the registered pharmacist. So what if you don't want to be a registered pharmacist in Canada? So let's say if you have taken a biotechnology course, or let's say if you have taken a pharmacy technician course or chemical lab technician course, then you can actually, after you're done with your course, you can work in a biotechnology company as well, or you can work as a pharmacy technician as well, or you can work in a pharmaceutical company in a QC, QA, or packaging department as well. You can work in a different department, or there is another option as well. You can open up your own business as well. So many of my friends actually, they didn't do pharmacy, and right now some of my friends have opened up. Then let's say one of my friends has opened up his food restaurant, or one of my friends has opened his burger store or coffee shop. There are different options available, and you guys will still make a good money. So let's say if you were to work in a pharmaceutical company, then your starting pay would be $25 to $30 an hour. But if you were to work as a pharmacist, then it would be $45 to $50 an hour. Or if you, let's say, if you were to open up your own business of, let's say, food business, then you guys will be able to easily make $100,000 per year. But the only difference in between a pharmacist and if you were to work in a food company is, let's say if you work as a pharmacist, then you just have to work 5 days per week and only 8 hours per day, and you can make $130,000 per year. But let's say if you work in a food business, or if you own a business, food business or different.
Hello, madam.
Yes, Nishan sir.
Yeah, no, I'm Dharmendra, but I think Nishan's voice is not audible, right?
Yes, sir, Nishan.
No, I'm Dharmendra Gupta. Nishan's voice is not audible, right?
Yes, sir.
Okay, I'll connect with I'll call the Nishant to connect and I'll confirm. Okay, just wait for 30 seconds, please.
Yes, sir. Okay, no problem.
I think that's a technical glitch from the Nissan side. Okay, I have connected. So let's wait.
Yes.
And okay. Sorry for the inconvenience.
No problem, sir. We will wait for sir.
So I called the Nishant at Vancouver now, so he'll be connecting in 10 seconds. Okay.
Yes, sir. No problem. We will-
So where are we? What was the last sentence Nishant was talking about, madam?
Sir, drug interaction software and wo related to industry, food industry, and related to money purpose of the pharmacist salary and food industry salary comparison.
Okay. No problem. Nishant will start again with the starting with the drug interaction. Okay, not an issue.
Yes, yes, sir. No problem. Yes, Nishan, sir. Sir, your voice is not audible. Nishan, sir.
Hello, Nishant.
Yes, sir. Yes. Now your voice is audible. Sir.
Hello.
Uh, yes, sir.
No. I'm Dharmendra Gupta, but I called to Nishant. Okay, Nishant will connect in few minutes. Okay, 1 minute.
Nishan sir joined. Now Nishan sir is joined, sir. I think.
No, but his voice
But
is not audible.
yes.
So, Gina, madam, Nishant's voice is audible or not?
No, sir.
Okay. Thank you.
Okay, welcome.
Hello.
Yeah.
Yes,
Now,
Nishan.
Nishant, you can start with the drug interaction. Okay.
Okay, no problem.
Sorry for the technical glitch, everyone. We can continue. Okay.
So, let's say let's say patient is taking medication for depression, citalopram, and doctors prescribe a ciprofloxacin. So after you become a pharmacist, our pharmacist software is actually very smart. They actually tell about all of the drug interaction and drug interaction and everything. So as soon as I process a prescription for ciprofloxacin, it will pop me a drug interaction regarding QT prolongation. So in that case, I need to contact to a doctor, and I need to ask doctor to order an electrocardiogram for a patient. So if that particular patient has underlying heart condition, in that case, doctor will probably switch to a different antibiotic. So all of these are roles and responsibility of the pharmacist. So what happens if I forget to check for drug interaction and patient suffers from injury? So if I forget to check that drug interaction and if patient suffers from injury, then in that case, patient can sue a pharmacist for the negligence. So all of the pharmacists have, it's mandatory for them to take a liability insurance for 1 million. So depends on the injuries patient has suffered, patient can sue pharmacists up to $1 million. So it's not a very tough job or stressful job. It's a very easygoing job. It's just you need to keep your eyes open and you need to keep your brain focused while you are working as a pharmacist. So what are the other options? So this is about after becoming a pharmacist and what is the role and responsibility of the pharmacist. So what if you don't want to be a pharmacist? Or what are the other options other than a registered pharmacist? So let's say when you guys come to the Canada, you guys will be taking admission in the biotechnology course or pharmacy technician course or chemical lab technician. So based on that course, after you are done with your course, and if you don't want to be a registered pharmacist, then you can work in a biotechnology company as well. You can work in a pharmaceutical company as well, in QC, QA, or manufacturing department. Or another thing is you can open up your own business as well. So you can open up, let's say, your food business. You can open up your burger store or pizza store, food restaurant, anything at all. And as I said, everybody makes money. There isn't any competition over here. So you guys will be able to make good money in any field you are. So I would like to give you difference in between pay if you were to work in a pharmaceutical company, if you were to open up your business, or if you are working as a pharmacist. So let's say if you are working in a pharmaceutical company, your starting pay would be $25 to $30 an hour. If you have your own business, let's say if you open up a business, as I said about the coffee shop or Subway or pizza store, then you can easily make $100,000 per year. But difference is you will have to work Monday to Sunday, 8 in the morning to 8 in the evening initially, at least initially, until your business is booming. So initially you will have to work at least 8 in the morning to 8 in the evening, and after working 7 days per week, you will make 100,000. Compared to if you are a pharmacist, then you will just be working 5 days per week only, and that as well only 8 hours every day. 5 days per week and 8 hours every day, and you will still make $130,000, which is more than even after you will be working 7 days per week in a food industry. So it ultimately depends what your passion is and what you want to do. It ultimately depends on that. None of the thing is let's say inferior, or none of the thing is super superior. It depends what you want to do and what your passion is. So for the students who wants to be a registered pharmacist in Canada, we have actually developed a course for the students who are coming from Gujarat. We will be teaching students. It will be an online lectures, and it's starting from September 5th. We'll be teaching students, or we will be teaching them the course content of the registered pharmacists of the Canada, related to what are the important steps and important steps for the pharmacy exam. We'll be teaching all of this stuff to the students from September 5th. So I'll be teaching to students, as well as we have another very, very highly qualified faculty of pharmaceutics or biopharmaceutics. They will be teaching students as well regarding related to the course curriculum of the registered pharmacist. So any of you guys are interested, and if you want to be a registered pharmacist in Canada, then you guys can approach us and we can help you out with the coaching and everything. Whoever wants to come to Canada, I really want you guys to be prepared while you are in India to prepare for registered pharmacy exam, because when you guys come to Canada, you guys have lots of stuff on your plate. So let's say when you have taken admission in the course, you need to focus on your course. Together with that, you need to do your assignments of that course. Together with that, after you guys go to Canada, most of the students, they don't ask for money from India except their fees for the colleges. Other side expenses, they usually prefer to work and pay out all of the expense for, let's say, their phone bills or their rent, or their bus pass. So you will have to do a side job as well, a side work as well, to pay out for their expense. And then there will be a very minimal time remaining in that you will have to read for the pharmacy. So you won't get much time to read about it. So, but if you guys are prepared from India itself for registered pharmacists, then it will make your life easy, and then it will be very helpful, and you'll be able to crack pharmacy exam very easily as soon as you come to the Canada. So yeah, I think I have covered almost everything for you guys. That's about it. And I would like to hand over to my colleague Dharmendra Gupta. He will further guide you regarding admission and eligibility criteria and what are the different options in Canada.
Correct. Thank you, Nishant. Okay. So good evening, sir, and good evening, students. My name is Dharmendra Gupta. I am a pharmacy graduate from Ravi Shankar University, Chhattisgarh. After my pharmacy graduation, I have decided to pursue my career in management education. So I have done my management education from one of the prestigious institute of India, TFI Management Institute, Manipal. My voice is audible, right, Nisa?
Yes, yeah, it is audible.
Okay, thank you. And after management educations, I have done my executive MBA from one of the Ivy League College of Southeast Asia, Asian Institute of Management. And after my management educations, I have a experience of more than 10 years in student recruitment, international education consulting in a different companies like Boston Consulting, Bain Consulting Group and all. And currently I'm heading a different countries for India, Pakistan, Nepal, Bhutan, Sri Lanka, and Philippines for Future Foreign Limited. And I'll be explaining the different prospects in admissions, what are the eligibility criteria, and what are the different options available for Indian pharmacy students in Canada, in universities and colleges, and what are the different career options other than PBC related options for Indian students in Canada. I will explain you each and everything in details. Let's start with the admission process first, Nissan.
Sure.
So regarding the admissions, if any student, any Indian student or any South Asian student want to take admissions in Canada, first and foremost things is an IELTS exam. I would say IELTS is the second passport for Indian students. And IELTS exam, in each module, student have to get more than 6 band in each module. If your bands are higher, your visa chances is also higher in IELTS exam. There are other exams. I request all the student to mute, please. Thank you. And other exams are also eligible in Canada, like PT exam, which is acceptable in Australia. TOEFL is also acceptable in different colleges and university. Even Duolingo is an exam also acceptable in colleges and universities in Canada. But I would say if your bands is higher in IELTS exam, for getting visa success rate in Canada is higher compared to other exam. Even one more advantage of IELTS exam, if your bands is higher at 6.5 and it's more than 6.5 and 7 in each module, then your chances of getting scholarship from different universities are also higher, because there are a lot of colleges and a lot of universities are providing the scholarship. Like a Windsor University, Yorkville University is providing the scholarship of more than $10,000. Algoma University is providing scholarship for $6,000. Loyalist College is providing scholarship for $2,000. Again, it depends on which colleges and university student is applying. Depends on your IELTS score and even the education credential. Student will get scholarship. So scholarship, because the $10,000 scholarship is a much higher. It's almost 1/4 of your education fees for 2 years.
Excuse me, sir.
Yeah.
$10,000 per month per project.
No, $10,000 scholarship for 2 years.
For 2 years. Okay.
Yeah, and again, it depends on student will get a scholarship semester wise. First semester, student will get for $2,500. Second semester, again $2,500. Again, it depends. If student will not clear that particular semester, student will not get scholarship. So if any students or maybe any questions, maybe after the entire presentation, we'll discuss all the questions. No issue. You can mention all your questions. Okay. At the later stage.
Okay.
Okay, so these are the scholarship and admission requirement for Indian students. So let's go to the next slide, please. So these are the different eligibility criteria for students, because all the students are not most of the students don't have a more than 70%, 60% mark. So the eligibility criteria played a crucial role for taking admissions in Canada. First is the gap. If any students after BPharm, if he or she is doing a particular industrial experience in India, and after maybe 2 or 3 years, if he or she planning to go to the Canada, then educational gap is also acceptable in Canadian education for colleges and universities. Again, it depends. Some colleges and universities are accepting. Some colleges and
Students are
universities.
requested to mute your mic.
Yeah, thank you. So regarding the educational gap, some colleges and universities are accepting 2 years gap. Some colleges and universities are accepting more than 5 years also gap. And even the Algoma University is one of the premium institutes of Toronto, and even the other campuses as well, where colleges and universities are accepting more than 10 years educational gap also, and where visa success rate is higher. And the second point is a backlog. If any students have any backlog in their graduations, student have to submit their backlog clearance certificate. Backlog, I would say backlog is if any student is more than 10 backlogs, even in more than 5 backlogs, and even more than 15 backlogs is also allowed in Canadian educational institutes and colleges as well. And if some student have a less than 50% mark in graduation, then also acceptable in certain universities like St. Clair universities and Conestoga, and other few examples are there. But colleges and universities, all the options are available for all the students. Either it's more than 70% student or it's a less than 50% student. So that's why Canada is a top destination for Indian students. So next, this is a very interesting thing. IELTS conditional admissions, and next is the academic conditional admission. I think somebody's mic. Let me check. Okay. So I will explain IELTS conditional admission and how it works for the Indian student. If any student is preparing for IELTS exam and he or she have taken IELTS exam registration, then on the basis of that registration, student can apply to the colleges and university in Canada. So depends on IELTS registrations, Canadian colleges and universities are giving a conditional admissions to the students. So once student will get final bands in IELTS exam, maybe after 2 months or 3 months, he or she can able to convert their conditional admissions into unconditional admission. So no need to wait for your IELTS results also. That is one of the good points for Canadian education system. And the second is academic conditional admission. That is also very useful for the students who are studying in third year and even in the fourth year also. If any student don't have a provisional degree certificate and final degree certificate, without that student can apply to the Canadian institutes, Canadian colleges and university, and student can get a conditional offer letter. And even that conditional offer letter means that is a letter of acceptance. It's mentioned that student have to submit the final year degree certificates or provisional degree certificates. So at the later stage, student can submit your final degree certificate, and he can take a visa, and all everything process will start for flying to Canada. So this is very different eligibility factors which played different students in a different category wise, like a gap, backlogs, less than 50% mark, and conditional admissions in IELTS, as well as conditional admission in academics in graduation like a pharmacy. So next, please. So these are the different career options. I think Nishant have explained very well what are the different career options available other than registered pharmacists. Pharmacy technicians is one of the popular demanding course in Canada, across the Canada in different cities. Research and development, if somebody is interested in R&D field, then also career options is available. There are very few, but options are available, depends on credentials and IELTS score. Biotechnology, as Nishant have completed his biotechnology course from Centennial College. That is one of the popular college for Gujarat, Punjab, and even the South Indian students. Q and QC related courses, pharmacy assistant related courses also available for the different colleges like Canada College and Conestoga College, Niagara College. Healthcare administration, that is a management side field, little bit mix of management, even a hospital administration. If somebody interested in hospital related field, pharmacy students have a Great career options for healthcare administration field, that is related to operational field. So that course is for 2 years, diploma courses, postgraduate diploma courses in Canada College, Conestoga College, where students have a exposure for a hospital administration related field. And even in hospital administration, you have a chance to work in a as an operation manager of that particular hospitals in a healthcare industry. If somebody is interested in IT field, then healthcare and IT field is also flourishing in Canada, not in Canada, even in across the globally, healthcare and IT mix, because now technology is changing the entire scenario for each and every field. So that's why healthcare IT field is also one of the suitable field for the pharmacy students if somebody is interested in a healthcare administrations, because in second year you have a chance to choose the different subject related to related to healthcare IT. Food and nutrition, that is a normal course. And even management, if somebody is not interested in research and development, then management field is also one of the vast field where you can have a chance to work in a sales and marketing. If somebody is interested in financial field, then also options available. If somebody is interested in human resource management, then also a lot of courses are available in management field. And in management field, a lot of colleges and universities are providing the one of the higher scholarship and management side, because once you are entering into the management and when you are taking admissions in management field, that's again it's a 2 years postgraduate diploma courses. And even like in Vancouver, University of Canada West, where 2 years master degree course is available for management for the management graduates. If somebody is interested in management, University of Canada West, that is one of the good colleges where placement is also higher, because once you are studying in the last semester or maybe the second year, a lot of companies and a lot of recruitment partners will come and they will after the interview you will get a final offer final job offer once you before you complete your management graduations. So a lot of options are available, depends on interest of that particular student can choose which colleges and which university, even which program pharmacy student can choose in Canada. So different options are available. So I will explain what are the this is the very few universities and colleges list. This is one of the popular colleges universities for Indian student, and most probably for Gujarat and Punjab region. Saturday College in Ontario, that is one of the most popular college. Georgian College, Centennial College, this is the college where Nissan studied in biotechnology school. Humber and Mohawk, one of the popular college for Gujarat region. Niagara, Fleming, Fancho, Saskatchewan Polytechnic College, Nipissing University, Red Deer at Stirling College. That is a public-private partnership between the Red Deer College and Stirling, because that's a two different college. In one is in Alberta and one is in Vancouver. But Red Deer Stirling College campus is in Vancouver, and that is a public-private partnership between two colleges and universities, because students will get a degree from Red Deer College, Alberta. St. Clair College in Windsor, and one campus is in Toronto, Conestoga in Ontario, NBCC, and the Northwest College. These are the few colleges, because a lot of colleges and universities are providing the pharmacy related courses exclusively. But I have mentioned one of the few colleges where popular courses are available for Indian students. Yeah. So next, please, Nishant. Yeah. I think Nishant will rightly explain about the future foreign, what future foreign is doing, and what is our vision for Indian students and even the Gujarat students specifically. Future foreign. So free of cost consulting we are doing for each and every students. We are doing a consulting free. It's a one-stop solution for Canada student visa, starting from admissions, and even the one more advantage, guaranteed admission in Canadian colleges and universities, because we have a tie-up with more than 500 plus. I would say it's more than 550 plus colleges and university we have tie-up in Canada, across the Canada, in different provinces and different cities. And future foreign is the only coaching one of the only coaching in India where you will get a coaching by registered pharmacist of Canada. So we have a 2 or 3 registered pharmacists in Canada from Vancouver, and even a few from Toronto as well. And we have our Indian expert faculties and team in India as well. And we have an experience of more than 7 years for onshore recruitment and even offshore student consulting experience. Earlier, we were doing onshore student recruitment from Canada, the people who are studying in first year. And if he or she want to change the colleges and university, we are helping their students for different cities like Toronto and even Vancouver also. So now we are planning to start our operations in India. So Nishant rightly mentions from 5th of September, from Teachers' Day, we are starting our PBC crash course. That is an online mode for each and every student will get a mixed flavor of Indian pharmaceutical industry as link with the PBC coaching in Canada. And that was an entire course is mentored by Mr. Nishant Patel. He has a great visions for changing the life of the pharmacy students exclusively for Gujarat, because Nishant is from Ahmedabad as well. And our office is located in Canada as well as in India, also in Nadia. So that's about the future foreign. And if somebody is interested for any other questions related to future foreign, how it works, how this online model works, and what are the course duration is mostly about the Saturday Sunday coaching, and only 2 to 3 hours coaching for Saturday Sunday, and that's exclusively for in blended mode, like an online model. Okay, so each and every student will get like a different PBC related factors, as well as the Indian how ANS and CNS system will help and cracking the PBC exam. So if any students have any questions, then floor is open for questions. Correct, Nissan?
Yes, yeah, that's right. And I'll show you our website as well for
the website.
So this is our website for the futureforeign.com. This is a process to become a registered pharmacist in Canada, pharmacy practice. And then our Canadian team, it's Akruti Patel. She is a pharmacist as well. Here in Canada, Vishal Parmar, he is a pharmacist as well. Nirav Desai, he did his so I gave you guys example of this guy. He's my friend. He did his master's from Northeastern University in US, and he couldn't maintain his status. And now he is in Canada, and he's a registered pharmacist in Canada. And Lisa Pridham, she's a Canadian, and she has over 17 years experience. She's in our team as well of Future Foreign, and Tanya Stretch as well. So this is our site. And yeah, let's do question answer session if you guys have any question.
Yeah, please unmute your mic and ask questions, as many as questions, because we are here to
I think,
solve all your doubts.
So we have, so what about the fee structures for the PBC crash course? So our fee is, Dharmendra, do you want to answer that question, please?
Yeah, for the PBC crash course, fees is around 20K, 20,000.
That's right, and which includes, together with our fee, we are actually providing complimentary service as well. So if you guys, if you guys were to take our PBC crash course, then we don't charge you anything for consulting for your admission or anything. So everything is included in that course. We will be able to get your admission as well, secure your admission in the Canada. And even after you come to Canada, if you have any question related to PBC, our Canadian team is here, and we will be able to help you too.
Yeah, even the post-landing service is also available, because there are a lot of friends are in Canada, in the Toronto, in the different cities and province. So we can able to help you, because we have a big networks in Canada.
And I'll provide you my cell phone number here. So even if you guys wanted to send me a message on WhatsApp, you guys can send me a message on WhatsApp as well. Let's say if you guys don't remember any question right now, and if you remember it later on, you can send me a message on WhatsApp as well.
Yeah, correct. कुछ भी क्वेश्चन पूछिए मैडम, स्टूडेंट को बोलिए कि मतलब it's not like a one way, it's like a two way. All the students have a lot of questions during your pharmacy days, so ask as many as questions. कुछ भी पूछिए, because we are on.
जी सर, one more
गुजराती में
question from
पूछिए,
Mirza.
इंग्लिश में कुछ भी.
Yeah, તમે લોકો ગુજરાતીમાં પણ પૂછી શકો છો. What is a
અમે
more
ગુજરાતી
beneficial
છીએ.
mask? What is
Mirza,
more beneficial?
unmute your mic and ask the question.
So we have got a question here, madam. So what is a more beneficial, master's or PG diploma? So the thing is, in Canada, it's little bit tough to get admission in masters. 99.99% students get admission in post-graduation diploma. Only 0.1% students get admission in masters, since there are only about nine colleges available for masters. Please mention mobile number. So only 9 colleges are available for the masters, and each college has about, like, I would say 50 or 60 seats. So only 540 seats available for masters. So you will be competing with the Canadian students. Together with that, you'll be competing with the students from all over the world as well. Another thing is in Canada, master's is totally research based. So if anybody has lot of research in their bachelor's, or if anybody has done a lot of publications in their bachelor's, and if that kind of whatever publication or research you have done in your bachelor's, and that kind of research is going on in Canada, then you can show your interest to the faculty in Canada and you can get admission in the master's. So I would say that post-graduation diploma of Canada is equivalent to master's of US. I would say, and it's both of the thing. I mean, if you were to get admission in master's, it's pretty good, but it's difficult to get admission. But even after post-graduation diploma as well, everybody gets the job. So it's up to you guys.
Yeah, I'll give the best example, like a master's course in MBA in India. If you're doing a master course in India, it's like an MBA, Masters of Business Administration. But if you're taking admissions as one of the premium colleges like I am Ahmedabad, you are not getting an MBA degree, you are getting a postgraduate diploma. And postgraduate diploma is an equivalent to master's. If somebody is interested to take a PhD, even after postgraduate diploma and after postgraduate diploma, that is also possible. So no need to worry about PG diploma and master's. Most okay.
Any
Hopefully we
question?
have, yeah, you guys should have lots of questions right now.
Hello, sir.
Yes.
Sir, I have one question that if I have interested in prescription handling, or we can say in for prescription writing in Canada, so I'm eligible for writing a prescription or prescription handling.
So prescription writing, only doctors can write down prescription, right? Pharmacists don't have authority to write down a prescription. Pharmacists do have an additional prescribing authorization in some of the provinces. So for an example, if anybody has a cold sore or strep throat, in some of the circumstances, pharmacists are eligible to write down prescription, but not in all of the circumstances. Let's say if anybody has a blood pressure, diabetes, cholesterol, if anybody is diagnosed with the cancer or tuberculosis or compromised kidney function, in all of those conditions, doctor has to write down prescription. There are very, very limited conditions pharmacists can write down prescription. And another thing is, let's say if any patient has been taking any particular medication for, let's say, more than 6 months or 7 months and stable on it, and patient does not have a doctor's appointment for another month, then in that case, we can give pharmacists can write down prescription for that particular duration for 1 month, but cannot initiate a new prescription for a different chronic condition in Canada.
Okay, sir.
Is that what you were asking to me, Smith? Or
yes, sir. Means sir, I have means doubt that if I am doing MPharm in India, then which field should I choose? Means I am doing master in pharmacology, or should I go with master in clinical pharmacy?
If you are planning to come to Canada, I wouldn't recommend you to waste your time to do masters in India, because they are not recognizing any other country's education. If you have taken education in Canada, that's they prefer, and based on Canadian education, you'll be able to get more job more easily compared to based on the education, master's education from India. For an example, my sister, she's a pharmacist in Canada as well, but before she came to Canada, she was in US. She did her master's from LIU, and she did her master in cancer research. And when she came to Canada, they didn't recognize her US degree, because she did her master's from US and she didn't have Canadian degree, so she didn't get she couldn't get job very easily in Canadian pharmaceutical companies. And then after that, she started preparing for registered pharmacist, and now she's a registered pharmacist. So if you're planning to come to Canada, I wouldn't recommend to waste your time for masters in India. Rather than that, just come to Canada. If you wanted to be a registered pharmacist, then just come to Canada. In those 2 years which you do masters, in the same time, if you come to Canada, you can be a registered pharmacist. Or even if you don't want to be a registered pharmacist, you can get your post-graduation diploma and you can get your job. Nothing is super easy. You still have to do your due diligence. You have to work hard for what you want to achieve, but everybody gets succeed. I haven't seen anybody is not getting succeed. Hopefully I have answered your question, Smith. Do you have any other question for me?
Yes, sir. Sir, is there any MS degree in Canada? MS Pharma?
In Canada, it's very tough to get admission in masters. Very, very tough. As I said, that there are only 9 universities available for the masters. And if you have done a lot of publications in bachelor's, and together with that, if you have done a little bit of research related, if you have done publication in various well-known journals in India, then your chances are pretty good to get admission in masters. But if you haven't done any of those things, then it's not impossible, but it's tough. I have seen only 0.1% people to get admission in masters in Canada from India. Any other questions, Smith?
No, sir.
Okay, all right. What are the future scope after completion of biomaterials and chemical laboratory applied sciences? So you can work in a various lab as well. In a let's say you can work as a chemical lab technician as well after you have done your course for the chemical laboratory applied science, or if you can work in a biotechnology field as well. So there are a wide variety of different options available, as well as you can work in a food company as well, food company who makes a different food. So it is a very, very good business over here. I mean, a very good opportunity here. There are lots of big food companies available, like Amul Dairy. There are lots of dairy options available where you can work in a quality department to check the quality of the various product, like let's say the quality of the product for bread or milk or different products. So there are a wide variety of options after you do your chemical laboratory applied science or biotechnology or biomaterial course.
So any more questions, students?
Any questions, students? So from Nirja, which course we can pursue while
Preparing for BBC, so
yes.
for an example, when I went to Canada, I took my admission in biotechnology course because so many of my other friends got admission in the same course, so I wanted to be with them. So I took admission in the biotechnology course. So you can take admission in pharmacy technician course as well. So if you were to take admission, so for an example, my wife, she's a registered pharmacist as well, and she took admission in pharmacy technician course, while I took admission in biotechnology course. So if you were to take admission in pharmacy technician course, it will be beneficial to you while you are preparing for PBC exam, compared to, like, I did my biotechnology course, which wasn't that bad, but in that I didn't get much exposure about pharmacy. But if you do pharmacy technician course, you get a little bit advantage, but it doesn't really matter as long as your focus is clear. Let's say if you don't get admission in pharmacy technician, then it's not end of the world. You can get admission in biotechnology as well, or any other thing as well. So as long as your focus is clear that what you want to do, if you want to do a PBC, then just prepare for it right when you are in India, rather than waiting to come Canada and prepare for it, and you'll be able to pass it very easily. So now I'm in second sem in MPharm. What is a better option after MPharm? Yeah, even after there are a few different options. So let's say if you are engaged and planning to get married, then you can put file for permanent residency as well, based on your points as well as on your spouse points, as well as based on your experience. You can put permanent residency file. That's the best option. Second option is you have to, if you want to come to Canada, if you can't come on permanent residency, you have to get admission in any course, or you can try for PhD as well. You can contact to probably different colleges or different universities here in Canada, and based on your research of MPharm, you can see that if you can get admission in PhD as well. Or another option is get admission in post-graduation diploma and do PEBC. So there are different options available. I think I had one faculty in Nirma. His name is Hitesh Vaidya. He did his MPharm from India, and then after that he was working in an academic. He was working as a faculty in chemistry, and then after that he was able to get admission in PhD course in in Newfoundland from Memorial University. So that's an option for you as well to get admission in a PhD directly. It
But again,
depends actually.
again, it depends on how much research and how much different research paper has published and all. So I would say for getting admissions in Canada, easiest way is taking admission in postgraduate diploma, even after MPharm or even BPharm also. Correct, Nissan?
That's right. Yeah, but after MPharm, since you have probably done your thesis and everything in MPharm, and you may have done research and other stuff as well, you can try for PhD if you want to, but there is no guarantee if you will get admission or not. But in post-graduation diploma, you will be able to get admission very easily. I have seen so many of students, or I mean, probably some of this faculty may already know faculty. His name is Raju Danger. He did his MPharm, he did his PhD. He was in academic, and after that he came to Canada, and he actually came on a permanent residency visa together with his spouse based on their point. And after that, he actually prepared for a PBC exam, and he's a pharmacist now. So registered pharmacist is one of the best option if you guys wanted to do. Have any criteria for scholarship in PhD? So for that, you will have to contact to that particular university. First of all, you have to get admission. That's the first thing. And yeah, everything is actually government funded. Entire PhD is not government funded, but it's funded through the various pharmaceutical companies. So all of the pharmaceutical companies, they actually wanted to get the research done through the people who are doing their PhD or doing their master. So everything usually is a research funded based. So you'll be able to get your scholarship as well during that time, I assume. But I would contact to that particular university directly and ask them that they have got any a scholarship program going on, and if they have any research funding of your interest going on or not, so you can contact to them directly over there.
Yeah, so I think we missed the one question. MS in public health. Yeah, MS in public health is a good option for Indian students. But I would say that US college is good compared to that UK University, Metropolitan University in London. But even in Canada, also a lot of options for MS in public health in Lakehead University and Windsor University. If somebody is interested for masters in public health in Canada, but it's a master's course, and again it depends on research-based course. So a lot of things and a lot of credentials is required for taking admissions in MS in public health in Canada. So any more questions?
So after PharmD, which course is better in Canada? After PharmD.
Dharmendra? So Dharmendra is basically, I did ask same question to Dharmendra as well. There are not many students actually after PharmD. He hasn't seen.
Hello? I think I have lost my connection. Hello?
Yeah, we can hear you.
Sorry, you are clearly audible.
Yeah.
So Dharmendra, do you want to answer this question after PharmD? Do you come across any students after PharmD getting admission in Canada in any courses?
Even after PharmD, as I explained earlier also, students have to take admissions even after MPharm and even after PharmD in postgraduate diploma only in Canada. That's the only one solution for taking admissions in Canadian colleges and university, because there are no as such specific course after PharmD you can able to take admissions in that particular field, like a master's in pharmaceuticals industry and all. All the courses are like a postgraduate diploma related courses available in Canadian different province wise.
That's
right.
That
is postgraduate diploma courses.
Yeah, I actually wanted to share with you guys one thing that recently I heard that one of the student from Nirma, she got admission in masters in pharmacology in University of Saskatchewan. So Nirma, they are opening, I think Nirma is open in 2003. So from 2003 to 2021, we are right now. This is the first student ever from Nirma. I saw that going in a master's course. So you can see the ratio of getting admission in masters. Even I applied for masters as well, and a lot of other my friends applied for masters. So many students are applying for masters already. Nobody is getting admission. So in this many years, I would say in from 2003 to 2021, I have seen only one student. She got admission only this year in master's course in pharmacology. I don't have much details about it, but I just heard it recently, about a couple of days before, that she got admission. So as I said, that it's not impossible, for nothing is impossible in this world. you guys can try. It's no guarantee, but that's what I have seen in my routine, that I haven't seen many people getting admission in masters. It's a little bit tough. So if you guys come from after masters or PharmD or BPharm, if you guys are coming after PharmD, then your best bet would be to do a registered pharmacist. But to do a registered pharmacist, you guys still need to get admission in a post-graduation diploma course. And your actually opportunities are very bright after you have done PharmD. You can actually work in a hospital as well. And if you have done PharmD, then your pays are higher compared to registered pharmacists who are working in a community. So let's say I'm working as a pharmacist in a community pharmacist. So compared to me, if somebody is working in a hospital as a hospital pharmacist, their pays are higher and pay scales are higher because they have got more responsibilities than anybody who is working in a community pharmacy. Lambton is reputed college or not? Is it good for me to take admission? Dharmendra, can you answer this question for Yash? Oh, is it for me? I think. Hey, Dharmendra.
Hello? Yeah.
There is this question here. Lambton in Sarnia campus is a reputed college or not? Lambton in Sarnia college.
Lambton is a popular college for Gujarati students. Like Lambton is an equivalent to Mohawk and Humber. So no need to worry about the college and all. Even after your completion of courses, campus recruitment is also available for Lambton.
Yeah, and if you need any help at all, you can let us know. If you want to, or even if you are interested in getting admission in any particular college, we are affiliated with more than 550 colleges and universities. So it's super easy. So most of these agents who are getting your admission done, they are not affiliated directly with all of the colleges and universities. While difference is we are affiliated directly with colleges and universities. So all of the sub agents who you guys are getting admission through, they are actually coming to us to get admission. So we are actually in direct link with all of the colleges and universities to get the admission. So if you guys need any help at all, we'll be happy to help you guys.
So any more questions?
Sir. Hello, am I audible?
Yeah, you're audible.
Sir, I have one question like that. If some student which do not have proper financial condition, or he or may she maybe want to become going to be Canada जाना हो, तो उसके लिए कोई other कोई scholarship की exams वगैरह हो तो आप थोड़ा mention कर सकते हो?
Sure, yeah, Dharmendra.
नहीं ऐसा कुछ स्कॉलरशिप का एग्जाम अवेलेबल तो नहीं है, लेकिन अगर आप जब कॉलेज में अप्लाई करते हो, देन सर्टेन कॉलेजेस एंड यूनिवर्सिटीज दे डिपेंड्स ऑन योर क्रेडेंशियल, दे आर प्रोवाइडिंग स्कॉलरशिप. ऐसा कोई पर्टिकुलर एग्जाम नहीं है या ऐसा कोई गवर्नमेंट से कोई नहीं है, लेकिन बट गवर्नमेंट में कुछ स्कीम चलता है. जैसे गवर्नमेंट ऑफ गुजरात में इफ आर प्लानिंग टू गो टू मे बी अब्रॉड, देन यू हैव टू फिल दैट पर्टिकुलर एप्लीकेशन फॉर्म एट गांधीनगर एंड यू कैन गेट scholarship from government of Gujarat.
And it depends on your all 4-year marks as well. Depend on that as well. You can get your scholarship. So for an example, my wife, she took admission in pharmacy technician course and her GPA was very good after getting admission in pharmacy technician course. So she was actually getting some of the scholarship from Sentinel College itself. So when you get scholarship, then that scholarship will be particularly for one SEM only. It's not for all 4 semesters. So, but if you perform very well in the first semester, then that scholarship will be carried forward in the second semester. If you perform very well, then it will be carried forward in the third semester. And the other thing is, so many of my friends, they are actually coming to the Canada via loan as well. So you can take loan as well and get admission. I would like to give actually one example of my friend. It's a sad example. So he is a pharmacist right now here in India. So he's I wouldn't mention his name. So let's say his mom was passed away when he was a kid. His dad was passed away too, and he was raised by his mama એને raise કર્યો હતો. અને પછી એની financial situation પણ સારી નથી. અને એ લોન લઈને આવ્યો ને એને બધું લોન ને બધું એના મામા એને હેલ્પ કરી, બધું કાગળ અને બધું કરી આપવામાં. And based on that, he was able to come to Canada એટલે એવું નથી કે તમે ના આવી શકો, તમે લોન ને એ બધું લઈને પણ આવી શકો છો, and then you can pay out your loan after you come to Canada. You can do after you become a pharmacist, it's super easy. You can pay it like within, I would say, 5 or 6 months. You can pay out all of your loans and everything. So it's not a difficult option at all. It's just you have to explore your different options. Yeah. Hopefully I have answered your questions.
Yes, sir. Yes, sir.
Okay.
I think so now all are clear. And
Okay, ma'am. Okay.
So now we can conclude.
thank you,
ma'am. No problem.
Nishant sir and Dharmendra sir, for clearing the doubt and explaining nice way. And students, I hope all students now clear about the PEPC exam and the criteria how to take admission in the Canada university, and what is the criteria for the education and the career perspective. So now I would like to request Sainika ma'am for vote of thanks.
I thank you so much, ma'am. Thank you for your time.
Okay, thank you so much, sir, from by giving this such a nice information regarding this role of pharmacist in Canada, as well as how which are the steps that by which using these steps we can get the registered pharmacist in Canada. Again, you have given information about the various scholarships as well as various courses which we can choose, or our student can choose for the further study, and they can settle into the Canada. So thank you so much, sir, and thank you so much, Ankit sir, for giving this encouragement, like this kind of information our student also can get, and in future our student can get help from you people. Thank you so much, sir, and thank you so much to all our SIPS faculties as well as students for the cooperation for this nice webinar. Thank you so much, sir.
Thank
Yeah,
you.
no,
Thank you.
thank you so much for organizing this webinar for the students. And if students have any questions, let's say tomorrow, day after tomorrow, whenever, just send us an email, or I have shared my WhatsApp phone number as well. You guys can send me a message as well, and I will try my best to answer. If I don't know answer, I will do research and get you the right answer for you guys. So thank you so much.
Thank you. Thank you.
Again, thank you, Nishant sir and Dharmendra sir. Both.
Hello.
Yeah, no, thank you so
Yes.
much. Ma'am.
Hello, sir.
Yes, Nishant bhai.
Yes, Ankit bhai, કેમ છો?
Yes, fine. I think the webinar was nicely conducted, and the
Thank you,
doubts
sir.
of the student are also cleared. So thank you on behalf of our SIPS family for spending your valuable time. Thank you.
No, thank you so
Thank you.
much,
Thank
sir,
you,
for
Ankit, sir.
thank you so much for organizing this webinar, sir. Thank you so much.
Sure. Thank you.
All right, sir. Okay, thank you.
Bye.
Okay. Thank
Bye-bye.
you. Bye bye.
Thank you,
Good luck, students.
Nishant sir.
All right.